Is principles of open extractions, and that's when we are creating a flap, raising a flap off the underlying bone, removing some of that bone. We're creating grooves where the periodontal ligament is on the mesial and distal aspects of the root, sectioning the tooth if we need to, and then extracting those parts of the tooth, and then we suture this flap closed so it can heal by primary intention. And there are three types of flap. They all have a horizontal incision, and then they may have 0, 1 or 2 vertical incisions. So this is our horizontal incision. So when we do a closed extraction and we cut the gingival attachment to the tooth, this is a bit like that. All we're doing is putting the blade into that gingival sulcus. We put it down until we can feel the tip of the blade is on the ridge of bone, and then we walk the blade along as far horizontally as we need. So that's our horizontal incision. The vertical incision then is perpendicular to that gingival margin. And you can see this is our mucogingival junction here. So our vertical incision has crossed that mucogingival junction. So looking at these two incisions that we've made, what shape of flap do you think this is? Triangle, yeah, so the base of the flap is going to be this area here. So that's our triangular flap, one vertical releasing incision. The envelope flap is just one long horizontal incision. Okay, so we're cutting in the gingival sulcus, we're cutting that gingival attachment to all of these teeth. We are still raising the tissues beyond that mucogingival junction now, but we get this envelope as if we were opening an envelope and looking down into it. So quite good where we've got a lot of teeth in a row that we want to extract, if it's full mouth extractions in a cat or your Yorkie with periodontal disease where you're pretty much taking everything out. And of course for our crown amputation in our premolars in cats as well. Triangular flap then has got one vertical releasing incision plus the horizontal incision. So this is a carnassially in the dog. We've made one vertical incision here, we've made our horizontal incision here. This is a cat, we're doing many teeth in this quadrant, so we've got our vertical incision here, and then this is our horizontal incision. Try not to place your vertical incision too close to the tooth that you're extracting, and equally don't place it over a tooth that's staying. Try and kind of put it in the middle if you can. And then a pedicle flap will have two vertical releasing incisions, so one here and then one here. Now, hopefully you can see that for this flap, in this position now, the blood supply is basically restricted to coming from the base of this flap. Okay, so if you make your base very narrow, then there is a chance that the tip of your flap will necrose and your flap will dehiss. So essentially, if you can get away with making an envelope or a triangle flap, then do that. If you need to make a pedicle flap, then make sure the base of your flap is nice and wide. So this is actually quite an old photograph now. I would probably prefer to do a triangular flap for this tooth, extend this horizontal incision probably beyond premolar 1, and then if I need more access, I can always make a very small vertical releasing incision here. All right, let's just look at some videos. So this is a cat. I'm making the initial incision. The cat's lying on its back. I'm making a triangular flap. So I'm doing one vertical incision rostrally. We work around the tooth or the teeth that we're extracting in the sulcus. And then we extend that horizontal incision caudally. And I'm holding the blade, I'm holding the scalpel handle like a pen. I'm literally just doing kind of stab incisions, walking it backwards. And then making sure I cut the gingival attachment on that palatal aspect as well. And what we'll do in the lab downstairs, there are some surgical marker pens out. So before you start cutting your flaps, I want you to mark on where you're going to cut, and then I can check it and make sure you've got it in the right place.